If you could have one superpower, what would it be? This is such a good question, and I literally spend so much time thinking about this. How pathetic is that? Well, the funnest superpower would be to be able to fly, but I actually don't think it's that useful. I think the most useful one, so I'm going to say, is to be able to actually read people's minds. I think that would be very helpful. Can I use more than 3? Just kidding. I would say kind, curious, I'm gonna leave it at that. Kind and curious. Hardworking. I would say hardworking. That's like at my core. I will confess, full disclosure, I did not have a nighttime skin routine until a couple of years ago, and I would go to sleep with makeup on. I never wore a lot of makeup, but I would not remove it. And I have learned that that is not a good idea. And also, it's not a good idea to go to sleep with the grime of the day on you. So I think everybody should cleanse. You should cleanse your face, which I do with a gentle cleanser. And then I put retinol and an antioxidant, which for me is a combination product, which is awesome. And the retinol helps with anti-aging, it helps increase the collagen, and the antioxidant actually reverses DNA damage, which contributes to aging. And then I heavily moisturize. I have really dry skin, so I moisturize many times during the day, and especially before bed. What makes me feel beautiful? I think laughing and not feeling fat. It's true though. Right? I really want to go to Iceland. I really am excited to travel to South Africa. And I also really want to go to Egypt. Good ones, right? I don't have big regrets about major things, and even setbacks. I feel like I tried, I risked things, I did things that were not popular. I think my only regret, and I don't know how I could have really changed this, but was to be bolder and to really say what I thought and felt. When I look back on the younger version of me, I think I tolerated a lot. As a lot of young people, especially young women, I think we tolerate a lot. And I wish I had spoken up more. I wish I had taken that risk, and I didn't. And I do regret that, but I don't know how I would have done otherwise and survived. So I understand it, but I wish that were different. So I recently just started a real routine that I've been sticking to, and I had been starting on a lot of things. I love yoga, and I had been doing that. Then I got sick with the flu, and I kind of fell off the wagon. But now the thing I've been doing recently, which I highly recommend for especially women over 40, is weightlifting. And it doesn't mean you have to bulk up. It doesn't mean you have to get any bigger, but it's really about strength and strengthening your bones even more so than your muscles. And I do that 3 times a week. And then I also do cardio 3 times a week. And then I incorporate some stretching and yoga into those routines. So I try to do something 6 times a week, and I'm doing it. Can one of the things be a live being? Okay, so I would bring a dog, and I would bring, and the reason why dog rather than people is it'd be too hard to choose the people. Like, it'd be like Sophie's Choice. You can't do that. I would bring reading material, and I would bring handicrafts. I globally couched that, so I had, stuff to do with my hands. I think I have become a good listener. And one of the things I learned in medical school, and it really stuck with me, is that the average doctor interrupts their patient within 30 seconds. And I realized what a mistake that was. And I realized that when people are talking to you, if you interrupt them, then they have to start all over, meaning they don't really trust you, they don't think you're listening, and you're not if you're interrupting them. Sometimes there is information you need to get, and you're going to have to, you don't have unlimited time, but I think that it is really important to be a good listener. But there are two ways of listening. One is what they're saying, and then one is what they're not saying and what they're not telling you. And so if a person is telling me something, but it just doesn't match up with the vibe I'm getting from them, then I will question it. And one of the things that makes it hard for people to talk to their doctors is if they're anxious. And if they have a lot of anxiety, then what they say may not be very accurate. I think this is very challenging, and I think it's very challenging in your early career, and I did not do a very good job of nurturing myself or my family. And I think at some point I realized that, and really the point was when I wasn't feeling well and realized I wasn't getting any younger, and I had to start taking care of myself and spending more time with my family. So I did that. And I just changed my lifestyle and changed my work habits and started saying no to some things at work, which was very challenging and difficult. But you can't take care of other people if you're not taking care of yourself. And I firmly believe that. I don't know if I have bountiful energy, but it is important to me to have meaningful work. And I do think being a doctor and a surgeon is meaningful work. And that is very helpful. But then the other piece is really taking care of yourself and sleeping and eating well and trying to exercise. And then the other part that people don't really talk about that much, but is having fun and laughing and having joy in your life. And I think without those things, it's really impossible to have energy and light. And you need that to be able to do hard work.